Many ideas about what we ought to do about healthcare are already being discussed at kitchen tables, throughout communities, and in forums across the nation. One idea is a mandate that everyone must have some minimum health insurance, privately or through work. This option has its benefits, but it would also put a larger burden on businesses and might penalize people who simply have no money for any amount of insurance. It may still seem like the best option, but it has its consequences.
The other thing that, some students have talked about is they go to a health insurer and get rates, and then they compare those rates to what they actually make a week. And it's such a disproportionate amount of their income that would have to go that they say, come get me. Mm-hmm. They're willing to risk whatever penalties could be assessed to them because they don't want to part with that much income, because then that affects how they live, where they can live, whether or not they can have a car, whether or not they can pay their other bills. So they're consciously opting not to have it.
With health insurance, it's completely a matter of, do I have an immediate need for this, or do I not have an immediate need for this? And if you don't, then it's so easy to put it on the back burner, especially if there aren't any consequences, which I don't think there really, should be any consequences if you can't pay for it. I mean, that's just horrible.
A friend of mine was telling me about another state where they actually have a subscription service for ambulance care. And you pay your fee at the beginning of each year, and when you get sick, the ambulance will come and get you. And if you don't pay the fee, the ambulance won't come and get you. And that offended me personally. And so I don't think that I'm quite ready yet to deny care on the basis of one's ability to pay. I think that, as the doctor indicated, that everyone deserves a quality of care, and I guess where the real rub comes in is how high a quality of care.
Another idea is to restrain out-of-control prices, perhaps via government cost controls. Doing so would make more people able to afford health care, but would involve interference with the free market and could lead to less use of expensive, high-tech treatments. This option protects certain things we hold valuable, the idea of fairness, of getting good value for what we pay for, but at the expense of preserving our free market system, which many people see as the best way of keeping prices down.
I hadn't been feeling well, but I thought it was the stress of unemployment. And I applied for health care to try to help me get to the next gap, miraculously in that regard, I thought, because the day I got my card, I went to the doctor immediately because I knew I wasn't feeling well and it was time to finally check it out. I did need emergency surgery. I had now, thankfully, I know a benign tumor, but it was a very large one in my abdomen. But after some months, was sent a box of mail, and all these bills were coming in from the surgery. And I thought, well, I have health care, everything's fine. The main surgery was rejected. The claim was rejected, and they were trying to say it was a pre-existing condition. I hadn't been to the doctor for this, but so I tried to fight it. Was on that campaign for 4 months, and then election day came, and I was unemployed again. Did the best I could for a full year of fighting this. And after a year of trying to fight it and just the bills that had mounted during my recovery time and unemployment, I just couldn't handle it anymore, and I made the very difficult decision to declare bankruptcy. All this because I got sick. I have to pay a $1,000 cell phone deposit if I switch cell phone companies. Deposits for utilities. My car insurance doubles. So my car insurance doubles because I was sick. I mean, really, if you think about it, that's really the connection.
And I think we all benefit from having a much higher diagnostic quality of care and other types of care, pharmaceutical and others. And I don't think any of us want to give that up, and there is a certain cost associated with it.
I would be in favor of looking into that, tort reform and malpractice insurance and things like that. I mean, that's something that, however, you can't eliminate it all. I mean, there's got to be a way of weeding out those that don't belong in the profession and things like that. So, I don't think you can just say, well, there can't be any lawsuits anymore, but there's got to be some way of reducing the amount of money that's costing all of us.
Still another option is creating a single-payer public system. This system would be simpler, and would ensure everyone can go to a doctor, not just an emergency room. But it means trading our free market system for a government system, and makes individual behaviors, like smoking or using drugs, the public's responsibility.
There are parts of our system that are already, everybody is covered. If you're 65, you get Medicare. Or also, if you had end-stage renal disease, you get Medicare. And so, actually, my family was a beneficiary of that because my first wife had kidney failure. But you can't, if you did that for every possible disease, the cost would be so high. You know, before the early 70s, people who had renal failure just died. But they didn't run up the cost. And so, some people are incredibly expensive to keep them alive. And so, it's assuming that if you have the federal government pay for it, that the resources are unlimited, but that's really not the case. I mean, if the money is spent, it comes either from somebody's pocket or it comes from everybody's pocket a little bit. And if it comes by taxes, well, everybody pays more taxes. And if it comes by deficit, well, eventually your money's worth less. And so you pay anyway. And the question is, how much should you spend to keep somebody alive?
If we have national health care, there's questions I have about what it should care for. And I'd really be fascinated. Let me just throw out a few. Should it refuse to pay, or should it pay for abortion? Should it refuse to pay or pay for someone who doesn't take care of their own health and is astronomically obese? Someone who is a chain smoker, someone who's a drug addict, someone who's an alcoholic, someone who's abusive. Should it pay for those things, or should it say no? And it comes down to, at some point, rationing, and there's ethical questions that come with this.
Because smokers have a higher probability of having problems. If we had a national health care system, I would be an advocate that if you are a smoker, you're going to pay a little bit more. There needs to be disincentives against behaviors that are destructive.
I think that's very clear. Obviously, if you were driving a motorcycle without a helmet and you broke your skull, in some accident, that's very clear. But most things are not very clear, and some people are more predisposed to certain diseases. So therefore, I could have 30 cigarettes a day, never get lung cancer. Another person has just one a day, and all of a sudden they get lung cancer. And so then we get into these genetic screening issues and all these other types of Brave New World type dilemmas.
And then what's risky behavior? Crossing the street against the light, that extra milkshake. Then you start really getting into individual rights. And if an insurance company knows that you've been eating cheeseburgers every day for the last 3 years, and you end up in the hospital, they can say, well, don't pay your bill. So you start infringing on a lot of personal liberties that I don't think the United States stands for.
We would all need to be willing to be a little further down the line and let some people go first. Are we?
We might not want to pay for experimental care, but if one of us becomes very ill, we're looking for that new drug or that new procedure to be made available to us.
But at the same time, my greatest fear is that government will be called upon to solve that crisis. I don't want the government running health care. I can't think of anything more frightening.
We are the government. The people that are down there in Washington, whether they're politicians and bureaucrats, are our employees. Saying that I don't want government making decisions for my health care, well, they've done it pretty successfully for Medicare. Why is it impossible that they could do it for the rest of us? Is that worse than Prudential, which has a bottom line?
It would be less expensive to have it up front. Go ahead and provide that care. I really think that would be one of the ways we could save on some of the expensive things that we do in taking care of people.
Where do we draw the line, and how much do we really want to spend? What percentage of our resources should we spend on health care?
I'm not ready to abandon the profit motive or capitalism either. I think, I am also not very sanguine about complete government programs. I think it's important to remember that there's more than two sectors. There's also a very large, very vibrant nonprofit sector. I think the government has a role, a very important role. I think the profit-making corporations also have a role. I think we're a very dynamic culture in this country, uniquely dynamic. I think corporations who don't provide health care, for example, as they tried to do in Georgia, I think they did successfully, can be taxed to provide those services. If you're going to have corporate profit at the expense of your workers, then you can pay into a regulated system that makes sure that your workers have health care. I think we can have it all. I think if there's anywhere in the world where we can do that, I think it's here.